Hey, future nurses, struggling with those vague NCLEX questions that barely give you any info? In this video, we'll break down 10 tricky questions with full explanations. Let's go. Question 1. A client recovering from abdominal surgery is more withdrawn today and avoids eye contact during the morning assessment. What is the nurse's best response? 1. Document the findings as expected post-op behavior. 2. Ask the client if they are feeling pain. 3. Notify the healthcare provider about the change. 4. Sit with the client and offer to talk when they're ready. Correct answer. 4. Sit with the client and offer to talk when they're ready. This response reflects therapeutic presence, which is a cornerstone of holistic nursing care. Post-operative clients are at risk for emotional vulnerability, including fear, anxiety, and post-operative depression. Nonverbal cues like withdrawal and lack of eye contact may indicate a deeper psychological response. Sitting with the client without pressure and offering time to talk communicates empathy and allows the client to open up on their own terms. This action builds trust and supports mental wellness, which is crucial for recovery. Incorrect options. Deep rationales. 1. Document the findings as expected post-op behavior. This dismisses a meaningful behavioral change. While mild withdrawal might occur post-op due to discomfort or fatigue, ignoring a shift in baseline behavior could result in missed mental health issues, such as suicidal ideation or depression. 2. Ask the client if they are feeling pain. Pain assessment is important, but this option jumps to a physical explanation without addressing the emotional cues. If the client was in pain, they would likely report it. Avoiding eye contact and withdrawing suggests emotional distress more than physical pain. 3. Notify the healthcare provider about the change. Premature escalation. Nurses are trained to conduct first-line assessments, especially for psychosocial changes. Not every subtle mood shift needs immediate provider notification, especially when a therapeutic intervention is within the nurse's scope. CliniqueRN Test-Day tip. In vague psychosocial scenarios, ask yourself, is this a behavioral cue that needs a nurse's presence before a doctor's prescription? NCLEX loves to test if you recognize do not disturb signs as cries for help. Sitting quietly isn't passive, it's active support. Question 2. The nurse walks into the room and notices the client staring at the ceiling, motionless and unresponsive to verbal prompts. What is the nurse's priority action? 1. Assess airway and breathing. 2. Attempt to reorient the client verbally. 3. Notify the charge nurse. 4. Call the healthcare provider. Correct answer. 1. Assess airway and breathing. This is a textbook recognize cues moment under the NCJMM model. An unresponsive, motionless client must immediately be treated as a potential medical emergency, such as a stroke, seizure, syncope, or hypoglycemic episode. The priority action is to assess airway and breathing, AB, the first steps in the ABCs. If the client has altered consciousness or no response, their oxygenation or circulation may be compromised. This choice shows critical clinical reasoning and protects client safety. Incorrect options. Deep rationales. 2. Attempt to reorient the client verbally. This assumes the problem is cognitive rather than physiological. If the client is not responding to voice or commands, then orientation strategies are not only ineffective, they delay emergency assessment. 3. Notify the charge nurse. While involving the team may be necessary later, the NCLEX wants to see if the nurse knows what must come first. Delegating without checking vital signs is unsafe. 4. Call the healthcare provider. Escalation should never come before the nurse's own focused assessment. Providers need objective findings, e.g., ABC status, responsiveness, vitals, before they can intervene. Skipping this violates the nursing process. Assess to plan to implement to evaluate. CliniqueRN Test-Day tip. Whenever a client is nonverbal, frozen, or unresponsive, even if the stem seems calm, treat it like a code waiting to happen. Start with ABCs. Don't let the vague wording fool you. Motionless and unresponsive means danger until ruled out. Question 3. A client recovering from pneumonia says, "I don't know why I'm still here," and turns away during the assessment. What is the most appropriate nursing action? 1. Encourage the client to take deeper breaths. 2. Sit quietly and allow the client space to express themselves. 3. Contact the provider to report the client's comment. 4. Document the comment and move on. Correct answer. 2. Sit quietly and allow the client space to express themselves. This scenario contains subtle signs of emotional distress, possible demoralization, or early depressive symptoms. The client's statement, "I don't know why I'm still here," may reflect hopelessness. The nurse's priority is to assess further by providing therapeutic presence, a silent but powerful tool that invites the client to share thoughts when ready. This response demonstrates emotional intelligence and opens space for deeper conversation without pressuring the client. Incorrect options. 1. Encourage the client to take deeper breaths. While pneumonia recovery includes pulmonary hygiene, this option misses the emotional cue entirely. This isn't about lung expansion. It's about a potential mental health concern. Choosing this shows poor cue recognition. 3. Contact the provider to report the client's comment. While some comments, e.g., suicidal ideation, do warrant escalation, this vague expression requires further assessment first. Nurses should explore meaning, tone, and risk before alerting the provider. 4. Document the comment and move on. Documentation is important, but passive. This option avoids therapeutic interaction. You must never skip a chance to connect when a client gives a potential cry for help, even if indirect. CliniqueRN Test-Day tip. If a client turns away, sighs, or says something vague like, "I'm tired of this," don't interpret it at face value. NCLEX wants to know if you'll stop and assess for depression or suicidal ideation. Don't jump to documentation or tasks. Question 4. The nurse notices a client pacing near the bed, clenching their fists. They've been cooperative all day. What is the nurse's next best action? 1. Speak calmly and ask how the client is feeling. Activate the hospital's behavioral crisis team. 3. Ask the client to lie down and rest. 4. Notify the provider immediately. Correct answer. 1. Speak calmly and ask how the client is feeling. This is a classic early warning sign of agitation. Clenched fists plus pacing means potential behavioral escalation. The safest and most therapeutic approach is to intervene early and calmly, using open-ended, non-confrontational dialogue to explore feelings. This buys time and builds trust before the client becomes aggressive or unsafe. NCLEX rewards proactive prevention, not delayed response. Incorrect options. Activate the hospital's behavioral crisis team. This is a reactive step, appropriate only if the client becomes aggressive or threatening. At this point, the nurse can still intervene effectively without escalation. 3. Ask the client to lie down and rest. This could be seen as minimizing their distress or even controlling, which may worsen agitation. It does not address the cause. 4. Notify the provider immediately. Again, this is a default escalate action. But nurses are trained to manage behavioral warning signs, not pass them off at the first signal. You must act within your scope before calling for help. CliniqueRN Test-Day tip. In behavioral scenarios, timing is everything. Intervene before a code is needed. If the client's body is talking, pacing, fist clenching, restless, NCLEX wants to see if you respond with calm, verbal de-escalation, not panic or avoidance. Question 5. A client with diabetes tells the nurse, "I just don't feel like myself today," but denies pain or specific symptoms. What is the nurse's first action? 1. Check the client's blood glucose. 2. Offer emotional support and reassurance. 3. Encourage the client to drink fluids and rest. 4. Notify the provider about the change. Correct answer. 1. Check the client's blood glucose. This is a physiological cue disguised as a vague statement. "I don't feel like myself" is a classic early sign of hypoglycemia or hyperglycemia, especially in diabetic clients. The NCLEX requires you to prioritize the assessment of critical data points, such as glucose, when a client presents a non-specific but suspicious change. A fingerstick glucose check is fast, non-invasive, and entirely within the nurse's scope, and could reveal a life-threatening glucose abnormality. Incorrect options. 2. Offer emotional support and reassurance. A kind response, but it assumes the cause is emotional. Never assume in diabetes. Rule out blood sugar issues first. 3. Encourage the client to drink fluids and rest. This would be appropriate for mild hyperglycemia after checking glucose, not as a first action. It delays key assessment. 4. Notify the provider about the change. Without objective data, this is premature. Nurses are expected to assess first, especially for known risks like glucose changes. CliniqueRN Test-Day tip. When a diabetic client gives you a vague "something's off" cue, treat it like a blood sugar red flag. Always. The NCLEX expects you to link common chronic conditions with subtle signs of early crisis, especially when vitals or labs can clarify it fast. Question 6. The nurse walks into a client's room and finds them sitting upright, gripping the bedrail tightly, breathing rapidly, and looking distressed. What is the nurse's first action? 1. Assess for shortness of breath or chest pain. 2. Offer reassurance and encourage relaxation. 3. Take a full set of vital signs. 4. Notify the rapid response team. Correct answer. 1. Assess for shortness of breath or chest pain. This vague scenario demands a focused assessment before anything else. The client's posture, upright, gripping bedrail, facial expression, distress, and breathing pattern, rapid, are nonverbal cues of respiratory or cardiac compromise, possibly a pulmonary embolism, anxiety attack, or MI. The first step is to ask targeted, cue-based questions. Are you short of breath? Do you have chest pain? This quick verbal triage determines the level of urgency and guides whether you need oxygen, rapid response, or calm reassurance. Incorrect options. 2. Offer reassurance and encourage relaxation. This assumes emotional distress without first ruling out life-threatening causes like a pulmonary embolism or MI. Supportive language comes after physical threats are excluded. 3. Take a full set of vital signs. Important, but not the first action. Vitals take time and delay the critical cue. Is this chest pain or SOB? Focused questions are faster and more targeted. 4. Notify the rapid response team. Too soon. Unless the client is crashing, your assessment is expected first. You'll need more info before calling for backup. CliniqueRN Test-Day tip. When posture, breathing, or behavior says, "I'm not okay," act before the vitals even beep. The NCLEX rewards fast cue recognition. Don't just reach for vitals. Ask direct questions like, "Are you short of breath?" first, It shows clinical intuition. Question 7. A nurse walks into a client's room and notices their breakfast tray is untouched. The client is lying in bed, facing the wall, and doesn't respond when greeted. What is the most appropriate nursing action? 1. Remove the tray and come back later. 2. Ask the client if they feel nauseated. 3. Sit beside the client and ask how they are feeling. 4. Document that the client refused breakfast. Correct answer. 3. Sit beside the client and ask how they are feeling. The client's behavior, facing the wall, not eating, not responding, signals emotional withdrawal. A red flag for depression, pain, grief, or feelings of hopelessness. In vague questions like this, body language is the clue. Sitting down shows presence, empathy, and concern without pressure. Asking, "How are you feeling?" opens the door to emotional or physical disclosure. This response reflects therapeutic communication and holistic care, both heavily tested on the NCLEX. Incorrect options. 1. Remove the tray and come back later. This delays care and ignores a potential behavioral change. Avoidance or delay is a common NCLEX trap. You must act on subtle changes. 2. Ask the client if they feel nauseated. This narrows the focus too quickly to a physical cause without assessing broader emotional needs. It assumes rather than explores. 4. Document that the client refused breakfast. Passive. While documentation is important, this doesn't address the cause of the behavioral shift. The NCLEX punishes passive chart-and-go responses when care is still needed. CliniqueRN Test-Day tip. When the stem shows a client turned away, withdrawn, or not talking, stop and initiate a therapeutic moment. NCLEX isn't just about knowing meds. It's about seeing the client behind the behavior. If you don't respond to silence, you'll miss what matters most. Question 8. During the morning assessment, the nurse finds a postpartum client sitting alone, crying softly. When asked how she's doing, the client quickly wipes her tears and says, "I'm fine." What is the most appropriate nursing action? 1. Encourage her to get some rest and privacy. 2. Document the behavior and reassess. Later, 3. Sit beside her and say, "Would you like to talk for a minute?" 4. Notify the healthcare provider about possible postpartum depression. Correct answer, 3. Sit beside her and say, "Would you like to talk for a minute?" This scenario tests emotional cue recognition and therapeutic presence, especially in the vulnerable postpartum period, when clients may suppress emotions due to fear of judgment. By gently inviting the client to speak without forcing her, the nurse creates a safe space for potential emotional disclosure. This is not just support. It's an early assessment of postpartum blues versus depression. Incorrect options. 1. Encourage her to get some rest and privacy. This deflects emotional engagement and assumes sleep is the answer. But crying without clear reason warrants connection, not isolation. 2. Document the behavior and reassess later. Passive documentation is not intervention. Delaying interaction may worsen emotional withdrawal or delay needed support. 4. Notify the healthcare provider about possible postpartum depression. Escalation before assessment is premature. The client may simply be overwhelmed. The nurse must evaluate the emotional state first. CliniqueRN Test-Day tip. The NCLEX expects nurses to pick up on what's not being said. When a client says, "I'm fine," but shows tears, silence, or avoidance, assume distress and engage gently, not clinically. The test will reward your empathy. Question 9. The nurse overhears a client in a semi-private room whispering to themselves while pacing. The client appears anxious but makes eye contact when the nurse enters. What is the nurse's best action? 1. Approach calmly and ask how the client is feeling. 2. Notify the provider about possible hallucinations. 3. Offer the client a PRN anxiety medication. 4. Reorient the client to time and place. Correct answer. 1. Dash approach. Calmly and ask how the client is feeling. This scenario presents ambiguous psychiatric cues, possibly anxiety, early hallucination, or internal conflict. The key here is not to assume, but to gather subjective and objective data through calm, therapeutic inquiry. The nurse should prioritize emotional safety and rapport building rather than escalating or medicating prematurely. Incorrect options. 2. Notify the provider about possible hallucinations. There is no confirmed hallucination in this scenario. Whispering may be self-soothing, not psychotic. Escalation without assessment is a red flag on the NCLEX. 3. Offer the client a PRN anxiety medication. Medication should never be the first response to subtle behavioral change unless you've assessed cause and verified the need. 4. Reorient the client to time and place. There's no indication of confusion or disorientation. This misses the true concern, which is emotional or psychiatric discomfort. CliniqueRN Test-Day tip. If the behavior is odd but not dangerous, resist the urge to escalate. The safest first step is always assess and connect. NCLEX watches for overreactions just as much as underreactions. Question 10. The day nurse is told that a client was tearful overnight and did not sleep well. During your morning assessment, the client smiles faintly and says, "It was just a rough night." What is the most appropriate nursing action? 1. Ask the client privately how they are coping today. 2. Accept the explanation and proceed with your tasks. 3. Encourage the client to get rest during the day. 4. Review the client's sleep logs and dietary intake. Correct answer. 1. Ask the client privately how they are coping today. This is a subtle behavioral cue. A faint smile and vague explanation like "just a rough night" may mask ongoing emotional or psychosocial distress. The nurse's role is to follow up on overnight handoff data and gently probe in a private setting. "How are you coping today?" offers space for emotional check-in and builds rapport without being confrontational. Incorrect options. 2. Accept the explanation and proceed with your tasks. This is surface-level nursing. It disregards continuity of care, especially when prior shifts report emotional changes. 3. Encourage the client to get rest during the day. Suggesting rest without assessing emotional state is dismissive. It's a comfort response, not an assessment. 4. Review the client's sleep logs and dietary intake. While supportive, this is indirect and misses the opportunity for therapeutic dialogue. CliniqueRN Test-Day tip. The NCLEX tests if you're paying attention to handoff clues. Don't ignore overnight data just because the client looks fine. If they were crying before, check in privately, not passively. If this helped, like and subscribe for more NCLEX tips. Drop your next topic request in the comments and grab free practice resources at CliniqueRN.com. See you next time.